So nanotechnology is any technology that involves materials that operate on the nanoscale. So that's 10 to the minus ninth in terms of size, meters, right? Very, very small, smaller than cells, to the point where you could probably think of them as proteins, comparable to the size of proteins that operate in cells and in the body. So there are actually several efforts to actually introduce what's called nanomedicine, right, and apply it to diabetes. So in many incarnations, things are trying to operate on insulin itself. So that's the idea of smart insulins, where you make insulin glucose responsive. So as blood sugar goes up, insulin becomes more available, and it's already there in the blood, just waiting to be activated so that it can act on the body and lower the patient's blood sugar. In other incarnations, the technology is encapsulating insulin in, say, nanoparticles that are glucose responsive or glucose sensitive in a number of different strategies to do that. And as glucose concentrations go up, as blood sugar goes up, that then causes a degradation of the nanomaterial and allows for a release of the insulin into the body to have a systemic effect on the patient. Some very cool stuff now is even trying to modify red blood cells, right, to have them be a drug insulin delivery vehicle, right, which is a very cool idea and thought in order to treat the disease. So I think what we're seeing now is kind of a proliferation of different approaches using nanomedicine to impact both type 1 and type 2 diabetes. So what we're seeing now are a lot of what I would call the proof of concept studies. Is it possible to make our insulin-based therapies smarter, more glucose responsive and sensitive, right? We're seeing that it is, yes, feasible and possible that we can do this. What hasn't been there yet, because you have to show the concept first, is optimize it to kind of make it practical for use in a patient. So right now we're seeing, certain technologies can show glucose responsiveness on the time frame of hours to days, right? I think it's more realistic for a patient if they can do something on a weekly basis, right? Or maybe a monthly basis would be extremely transformative, right? To get away from doing kind of multiple blood sugar checks a day, followed by multiple insulin injections, or by even taking drugs, right, on a frequent basis. If you can remove that kind of compliance from the patient, I think you'll see a much better control over their disease in the long run. And that has obviously implications for their long-term health. In my session, I saw a lot of interesting developments in terms of new therapies that are being pushed now into clinical trials, kind of advancing diabetes pharmacology, right? So I'd say that's certainly is one of the highlights. It's always exciting to see new technologies kind of being introduced, and as they're being shepherded through the kind of clinical trial and system on their way to actually becoming bona fide drugs. I think, for sure, probably within my lifetime, the way we are treating diabetes is going to change dramatically, right, compared to how it's done today. And that means it's an inherently exciting time for research in treatment for type 1 or type 2 diabetes.